The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, liposuction. New technology that literally dissolves fat off your body. With us, we have an expert on the topic. She's known as America's favorite dermatologist, Dr. Tess Mauricio. Dr. Mauricio, welcome to the program.
Great to be back, Randy.
Now, you always look good, by the
Thank
way.
you.
Always a pleasure to have you on the show.
Thank
Weren't
you.
you voted as best dressed at one time in Style magazine, best dressed doctor here in San Diego?
In San Diego it is, and hopefully I'm living up to the expectations of the voters. So yes, well, you know, I think this is why I love what I do. It's about art, it's about aesthetics, it's about beauty, and you know, body shaping, body sculpting. I mean, the doctor, your surgeon, has to have an eye for beauty, and hopefully, you know, my patients really appreciate when they see me. I'm dressed nice, you know, I'm well coordinated, because that's part of who I am.
Interesting.
And I think that's one of the reasons
So when you
why
look
they
for a
come.
doctor, do you think you should look for somebody that has an eye?
Absolutely.
Or that looks good, their office is neat?
And it's all part of the artistic part of rejuvenation and what we're talking about, body sculpting. Because
is it really sculpting, by the way, or is it just sucking fat?
Well,
Seems
this
straightforward.
is in the 20 years ago. It was really suction. That's all.
Right.
It's just sucking out fat. But now we've advanced so much in technology, in technique, and now it's truly body sculpting. And really, you have to be an artist because it's sculpting.
Is it the most popular procedure of all cosmetic procedures?
It is the most popular surgical procedure. It's the #1 surgical procedure in the United States. And the reason I think is because now we can achieve great results, very, very safe. So it's no longer scary to patients. They've seen friends and family members that have had liposculpting and they look great, and they know they can have that done.
You say it's life-changing for some people.
It's life-changing, I think, for most patients.
All right.
You know, they are mostly patients who have tried everything. A lot of them have tried dieting, have tried exercising, or they just want a new start.
For men, by the way. And who's doing more of it? More men, more women? What is it?
Well, I would say nowadays the reason that this whole market is expanding is we're seeing more and more men. The #1 area, the neck, the male chest, which you can understand can be embarrassing. After 40 or 50, men can develop, you know, fat in their chest area that ends up looking like breasts. And
have you been doing some of those?
Many, many, many.
Really?
Yes. And obviously
I hear
the
it's
abdomen.
tricky though, the chest.
It is tricky, but it's one of my expertise. And
Really?
you
Okay.
have to go in there with the smallest of tools and gently sculpt it away, and also blend it in the other areas that you're not doing. And that really is where the artistic ability of your surgeon comes in. Because in liposculpting, the result is not so much what you remove, it's what is left.
Interesting.
Yes.
Wow. Okay. So for women, what's the most popular area?
The most popular area for women, I would say, is still the abdomen and the waist.
Okay.
To recreate that nice waist and nice silhouette, and being able to allow women to wear the outfit that they can no longer wear. So that's a big area. The other area are arms. Arms are so...
How well do they treat?
Well, you know, arms are so important to cosmetic appearance of women. Basically, I have many patients who come in and say, I have not worn a tank top for years. I'm always having to wear a jacket to cover up my big arms. Well, before, with traditional liposuction, arms were one of those, you know, don't touch type of zone.
Is that right? Okay.
Absolutely, because of the fact that we were scared that if we remove the fat there, we would leave patients with loose skin, which ended up looking worse. But now with the technology we're going to talk about, and in my practice, we combine the latest in technology for sculpting and also skin tightening.
You say you're surrounded by equipment.
Exactly.
Tell me about your technology. What do you mean by
And you know, basically we offer the patients the best in technology along with really unparalleled artistry. And whenever I do a lipo procedure, I'm surrounded by my Vaser device, which is ultrasound liposelection, gently melts fat, leaving intact blood vessels and nerves. So it's really, truly a gentle way where we melt away fat, especially in patients.
Are you sucking as well? I mean, there is...
Well, that is not sucking.
Okay.
That's the first step. So just melt away the fat. but in a gentle way, non-traumatic way, where we was never able to do that before. And then I go ahead with my small little tools to actually gently sculpt away the fats,
So small, tiny cannula.
Cannulas,
okay.
That's the word, and that's the tool that we use. And nowadays, our tools are as thin and as small as the tip of your pen right there.
Really?
Before, when you watch like Extreme Makeover, the patients would be really scared because they see big tubes
But they're still
going
doing
in
it
and out.
though. I hear that there are, power assisted and bigger lipo. What are your thoughts on that?
The reason that surgeons are wanting to do that is it cuts down on the time for the surgeon. It cuts down on the energy and work that is involved in doing meticulous liposculpting.
So you're saying the results aren't as good, in your opinion?
Yes, because you can imagine if you have a larger tool, a larger tube, it's almost impossible to create a completely smooth surface. Whereas if you have a cannula as small as the tip of your pen, it's like sculpting, chiseling slowly away at the unwanted fat.
So the results are better today because of this ultrasound technology.
Ultrasound technology, patients actually will get less downtime, less trauma, better healing, and it's safer because you're not, there's not as much bleeding through the procedure. And then as far as
safer
sculpting,
than the old way?
Absolutely, much safer. I think that's one of the reasons why more and more patients are coming in to have liposculpting procedures now. You no longer have to worry, I'm gonna, something's gonna happen to me during a cosmetic procedure.
Now, so I understand this correctly. So the old way, it was kind of digging into the fat,
digging in,
scraping it
avulsing, yes, scraping,
and so
just kind of.
Now we
put
it a wire? What is it?
It is basically another metal cannula, but it has special ultrasound in the tip that goes and vibrates and then melts just
so it's
the
like
fat.
Heats the area.
Heats the area, dissolves the fat, and then I go in with my small little cannulas, and then I take it away. And then the last thing, which like we were talking about the arms, the last thing is I actually use a special laser called LipoLight.
Okay.
At the end of the procedure, after I've taken down the fat, underneath the skin, and heating underneath the skin to help tighten all of the areas that we've done.
So there's 3 parts of this.
Three parts, and this is what I call the My Lipo personalized body shaping procedure. And so every single patient gets a special personalized program in giving them the best results possible.
Do you find that these patients, after they get it done, that all of a sudden they're following a better diet, they're eating better, exercising more?
Of course, because unfortunately, and I tell this to all of my patients, if you stay the same weight, because they always ask me, how long will this last? You know, the results, because they love the results. How long will this last? So I tell them, if you stay the same weight, which means you have to watch what you eat, you have to exercise, you have to live better, then the results are permanent. But if you do end up gaining a lot of weight, if you let yourself go,
but those fat cells are gone though, right?
Those are gone. That's why it's forever. But if you gain enough weight, and some patients unfortunately, gain 10, 20, 30, 40 pounds, you can get the fat back in the areas.
So this is not just for the younger people. I mean, you get a lot of business people, a lot of successful people.
Absolutely.
40s, 50s.
Even 60s and 70s.
Getting liposuction.
Getting liposuction, getting liposculpture.
Right?
And I
really?
think it's a testimony to basically the technology, the advances in technology.
So a 70-year-old now can get this liposculpture.
We just did a 72-year-old man. And he's very healthy otherwise, because obviously you have to be healthy to have this cosmetic procedure. Very healthy otherwise, and works out, eats well, but had developed the male, chest, the fat in the chest, and fat in the abdomen and love handles. And he said all he wanted to do was be able to move better, be able to bend and tie his shoelaces. Certain simple things like that, and obviously wear a shirt without him feeling, self-conscious about the chest.
Yeah.
And we did that, and he recovered great. I mean, he was one of our best patients.
Can they go back to work the next day? I mean, what do you tell them?
It depends. Everybody is different.
Abs and flanks.
I did the lipo on my husband, abs and flanks. Went to work the next day.
I knew there was something, you
That's
look too good. You look too good.
That's why he had
his shirt.
Yeah, exactly. That's how and it didn't used to be like that.
How many pant sizes can you lose? I mean, how many dress sizes have you heard women?
Right. Well, I've had a patient where we can remove small volumes of fat, or we can remove larger volumes of fat. And we can remove as much as 4 liters of fat in a day. So that is a lot. That basically is about 8 pounds of fat.
Is that right?
Yes. And so I have patients who were like size 12 pant size, women's size, and they come back, they're like, I'm a size 8 now. I'm a size 8.
Now, are you getting a fitter patient because of this technology? You know, the lean athlete, just somebody that has maybe little saddlebags or...
I have a lot of personal trainers who come to me, and obviously they work out, they take care of themselves, but as aging and the hormones change, the fat distribution changes as well. So they start getting, you know, the belly. For women, they can't get rid of the thigh saddlebags or the inner thigh fat, the knee fat. Easy enough to do all of those procedures. Sometimes we can do them under local anesthesia.
Where they're
Patients are completely awake, in and out. And very, very little downtime. Patients are able to get back to work in a few days.
Of all the procedures, I mean, are they the happiest? I mean, the lipo patients?
I would say.
Afterwards? Really?
I would say, and I think that's the reason it's out there. People have heard and have seen.
Words on the street.
Right, right. I mean, everyone that you know
There's still a lot of doctors, by the way, that are doing the old lipo style.
Yes, and I think that's one of the main message that I like to get out there, is that you no longer have to deal and have the old, what we call traditional liposuction procedure done. We have advanced so much in technology, and actually body shaping technology is one of the hottest fields right now as far as research and development, because this is the #1 cosmetic procedure. So companies are out there developing safer, better types of technology, and we definitely have some of the best technologies that, you know,
okay, what about, knowing I was going to interview you on this topic, asked around, the bra strap area on a woman's back.
We just did 2 patients last week. This area.
You could do that?
Yes, with amazing results, because this area, actually the bra strap and what we call the back, upper back, and is so important, because that changes the way a woman's body is shaped. And again, as a woman, I can understand that. Because if you have fat there, you can't really pull your arms in, so you have a wider, more like what my patients call like a football, football player silhouette. Whereas when I reduce that, and I reduce it with the arms as well, women are able to pull their arms back. They now have a much narrow silhouette. They look a lot more feminine, and they're able to wear, tank tops. They're able to wear spaghetti strap dresses.
A lot of women are self-conscious about their arms. Do you think if they knew the ease of this, that they would all do it?
Yes.
Really?
Absolutely. I have people who come in and they're like, wow, I didn't know you could do arms, because that was the old teaching. The old teaching with traditional liposuction is don't do arms, because it's hard to make,
so the
to
heat
get
of it
smooth results.
Makes it bounce back.
Yes.
Put a little fat in the front. I guess fat anywhere. They get that little area.
Whenever I do arms on patients, when a patient come in to see me for arms, I always tell them if they have any fat up here, and we call it the fatty patty, right here, fat up here, fat on the back, I tell them we'll do everything at the same time, because to me, aesthetically, it makes sense to cover those areas as a unit. And like I told you, it totally changes their body shape. They love it. They feel sexier. They feel more feminine. And it's one of those things that I think, as a woman surgeon, I can truly appreciate for my patients.
So with, I mean, there's a big difference, between, guys know this. That flat stomach. The difference between looking a little sloppy in a dress,
and hot.
And just
yes.
So do you get that? There are people that just need just that little bit.
Yes.
Because I know somebody that does a lot of sit-ups every day.
And there are a lot of patients.
Randy, I need one of your doctors because I can't get rid of this little part, which I can't even see.
Right, and that's the thing, is when women come to me and they say, oh, well, my patients are telling me I'm crazy to think about removing this, but I can understand. Like you said, it is a different.
Do something about it.
Nowadays, and that's the bottom line. If there's something that bothers you about your skin, about your body, that bugs you, doesn't matter what other people say. Other people may say you look great already. Why do that? You can do something about it.
Quick break. We come back. I have questions about cellulite, how well it treats for cellulite, also the neck, and some before and after pictures. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Hot topic: liposculpture with America's favorite dermatologist. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about liposuction. With us, we have an expert on the topic, America's favorite dermatologist, Dr. Mauricio. Okay, now you don't call it liposuction, you call it body contouring.
Right, and body sculpting.
Body sculpting.
Sculpting.
You're really sculpting.
We really are sculpting. We have the smallest tools to really shape, to really sculpt away the unwanted fat, blending it into the areas that are, not being touched, and also creating smooth results, which we weren't able to do in the past.
Because we've all seen the celebrities, by the way.
Yes.
That where you get the lumpy, bumpy. Is that because they just didn't have the technology? Is that your opinion?
Well, they didn't have the technology, and also, the tools that weren't used were just incapable of creating smooth results. And also, you have to, as a surgeon, you have to be very, very meticulous, very thorough, very patient in removing and smoothing out all of those little bumps.
So there's an art to this. There is an art.
There's absolutely art to doing amazing, phenomenal body sculpting.
Now back to the questions about the buttocks again.
Right.
I've been told also not an area that is good to do.
I think that before, with the old technology, that was true. There were many areas that we couldn't do. The arms, which we discussed, the neck, the buttocks, the inner thighs, any area where in the past, if we thought, if we remove the fat, we would deflate the area and leave patients with loose skin, and it wouldn't look any better. But nowadays, with the technology we discussed, to tighten the skin after we remove and after we've sculpted the unwanted fat, we've blended it in.
So they get a firmer buttocks from this?
Well, they get actually better looking buttocks, absolutely look better under clothes. And then now with the new technology, they get tightening of the areas. And then we also, in our practice, advise patients to have a series of Vela-shape radiofrequency and infrared treatments after lipo to improve even more the silhouette, the skin texture, the quality, and even cellulite.
So you're not afraid, by the way, of the larger patient? Because there are certain patients that are big, but they've tried everything.
And, I want them to come see me.
Really?
Because many times we really need to just do multiple sessions.
Okay.
For safety reasons, we can only remove 4 liters of fat. And I talked to you about, that's about 8 pounds. That's a lot.
Wow.
That's a lot. However, some patients have more than that. And we just have to break it up for patient safety. I go back in, we do more, we do other areas. Instead of doing a full body liposculpting, maybe we'll just do the abdomen in one day. The next day we'll do the flanks and the back. Then the next day we'll go with the thighs.
Is that right? Can it be the next day in certain cases?
Yes, it can be if they're really motivated. Most patients will do it about a month afterwards, depending on if they're planning to look great for their wedding or their honeymoon.
Do people do this for occasions?
Yes, we have a lot of people doing it for reunions. I've just finished we just did a patient, and he was getting ready for his daughter's wedding.
Wanted to look good.
And he wanted to look good in his tux.
So the neck, though, the neck is really a popular area.
The neck.
I know you look a lot younger. I've seen some of these photos of yours.
Yes, the neck changes the way people look instantly. 10 years younger, 10 pounds lighter.
Really?
In 45 minutes. And this is one of those things where I think the neck is even more important than the rest of the body. Because obviously, like you can cover things up with your suit. I can cover my things up with my clothes. But our faces, you can't hide it. Patients see it in photographs. Other people see, when you look in the mirror, you see it.
Is it a routine procedure?
It's so easy, Randy. I mean, if people know.
It's not sore, it's not as...
It's not, because we're dealing with small instruments. It's very gentle. We do skin tightening at the same time. It's a 45-minute procedure. I make 3 tiny little openings. There's no scar. Can you believe there's no scar? But I can sculpt away the unwanted, genetic fat that hangs out in this area, the neck, the jawline, and the jowls. So patients can get their chin and jaw definition back like how it used to maybe 10 years ago, or when they were 10 pounds lighter. And patients...
Are couples doing this together, by the way?
Oh, yes.
Like husbands and wives coming in?
The 72-year-old man, his wife actually came in a couple of weeks later for her neck. And she's 68. So you know, we're definitely seeing older patients. We're seeing patients with larger volumes of fat that, you know, we need to do multiple sessions. We are also seeing a lot of patients who've had bad lipo in the past.
Okay.
And they want
help. So bad lipo
can
based
be
on
remedied.
Unevenness?
Based on unevenness, based on just lumpy, bumpy results, based on just...
So because of this new laser, you're able to smooth that out?
Right. We can definitely, I mean, this is what I tell patients. When you're looking for someone to do your lipo procedure, do not go just because it's the cheapest.
All right.
Because once it's done, although I can help, and I've done a lot of repair work, although I can help smooth things out, it's never the same. With lipo, you should do it right the first time, and that's always my goal, which is why I spend so much time. First time I get my patient on the table, I make sure this is the first and last time, because once someone is there on the table and they've had lipo done, when I go back in, there's so much scar tissue, there's fibrosis, so there's only so much I can do. But now, it does offer patients hope. The ones who've you know, embarrassed to show their bodies because they've had lipo, just tragic. You can get it fixed.
What's wrong with diet and exercise, though? I mean, somebody can watch this and say, what's wrong with diet and exercise?
There's nothing wrong with diet and exercise, but as we all know, as you get older, sometimes diet and exercise alone doesn't get rid of, you know, you just don't get rid of the lumps.
I mean, after pregnancy, I know with all the sit-ups in the world, sometimes women just can't get rid of. It's unfair.
It's not fair. It's not fair. And I've done many TV segments on post-baby bodies, how to rejuvenate, how to restore your body to how it looked like before the baby. And we definitely see a lot of moms, and that's why I say many of my patients who've had babies feel so much more comfortable with me because I've had 2 kids. I know about, you know, your body's not the same, but we can sculpt away those unwanted.
You can't sculpt yourself, though, can you?
I can't. That's the problem, Randy. So I have to rely on diet and fitness, and so yes,
that's a shame.
It's
that's
true.
Terrible,
but yeah,
terrible.
but moms, the take-home message is there's hope. If you need a boost, because all moms, you know, we love our kids, but sometimes you just need a boost to get that confidence back, get the sexy back.
What if somebody were to say, I'm that someone, you're not a plastic surgeon. Is this your place to be doing liposuction?
It's interesting because actually the whole field of tumescent liposculpture, it was revolutionized by Dr. Klein, who is a dermatologist. You know, when we study, the fat actually is part of the skin. And so as dermatologists, we feel, obviously you have to get special training, which I have, and I've been doing this for over 5 years, and I've done many, many cases. But as dermatologists, we really feel like the fat is our territory.
So keeping it smooth, keeping it tight.
We know exactly where it is. When we do, you know, surgery on the skin, we go right down to fat. We go right down to fat. We know exactly where it is.
So maybe you're the best person then to go.
Right. It's
is that
instinct.
your feeling, by the way?
I think so.
As a dermatologist?
Well, this is the thing. When you talk to dermatologists who do liposculpture, we really feel like, because we've been trained to go least, not as aggressive, gentle procedures, you know, minimally aggressive, minimally invasive, we really are the experts in this type of procedure.
But non-aggressive doesn't mean you're not doing large volume.
Non-aggressive, yes, that's definitely true.
You're taking away a lot of fat.
I'm taking away 4 liters of fat, and very few surgeons
that's like
can
8
say
pounds
that.
Of fat.
Yes, so you can do it, but the whole time we're being gentle, and we know exactly where that fat layer is. So when the dermatologists get together, this is what you talk about? Oh yeah, we always say we do better job than plastic surgeons, for sure.
And I know you have a lot of friends that are plastic surgeons.
Yes, yes, and it's
they're going to give me a hard
things.
time that you said that.
I'm sorry, Randy, but I think it's true. I definitely think it's true.
Good for you. Okay, so take me. We literally have a couple of minutes. Somebody watching this, what can they expect when they go to your practice? I mean, how does the evaluation take place?
Well, when patients come in, I evaluate them, and then I ask them, you know, to show me the areas that are bugging them. And then that's when I can design a special lipo body shaping program for them. Some patients will need the Vaser if it's a larger volume patient. Some patients will need the LipoLite if it's certain areas like the neck, the arms, the inner thighs, where we would want extra skin tightening. My older patients, if you're over 50, you're definitely going to get LipoLite, because everybody needs skin tightening at that point.
Wow, okay.
If patients come in and they have had previous lipo and it didn't turn out great, I explain to them how these small little cannulas really help me get into those little pockets and really smooth out the results.
It's very good. It's very good, by the way. I was kind of anti-lipo going into this. Now I feel like
I
want lipo.
Exactly.
No
That's
kidding.
the whole. I mean, and it's really
good for you.
not like how it used to be, and that's my message. It's safer than ever. It's easier than ever. The technology is really there to support surgeons who are artists who really want to do sculpting, and so you know, it's a
You're
wonderful
busy. You're
field.
very, very busy.
I am very busy.
Your husband says she's working all the time.
Yes.
But you love it. Are you having fun?
I love it. I mean, when I see my patients, and it's one of those things, like I told you, a lot of surgeons don't like to do lipo.
That's true. That's what they tell me.
The reason I like it is when I see my patients the day after, when I see them in post-op, and we take away, it's like one of those makeover reveals, and then I show it to them. I have them stand in front of the mirror, and they're almost in tears.
Wow.
They cannot believe it. And I'm like, wow.
Do you ever get choked up every
again.
once in a while?
Oh, yeah.
Are you ever surprised with the results?
Absolutely. And it's because the added benefits of all these technologies, as far as skin tightening, as far as it's allowing me to treat older patients who in the past we'd just say, sorry, you are not a candidate. Now we're doing 60, 70-year-olds, and they're getting great results.
It was a pleasure. Thank you so much for coming on the show.
Thank you again, Randy.
Very good. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again or direct a friend to it, you can go to our website at wellnesshour.com. Just put in liposuction or lipo or liposculpture or Dr. Tess Mauricio. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.